988 is the number to call if you're in crisis and need support. It's a national hotline that's run individually by states. Here in New Jersey, the 988 response efforts have been growing, but funding for the program in this year's budget did not grow. I recently sat down with the Deputy Commissioner for Health Services, Valerie Mielke, from New Jersey's Department of Human Services, to talk about the hotline and where it's headed in the coming years. Deputy Commissioner, thank you so much for taking some time to talk to us. Can you explain to us what the 988 hotline is and how it all works?
Yes, Joanna, thank you so much for having me here today. So the 988 is actually a system of care. It's a system that is utilized for individuals who are experiencing a crisis, whether it be a crisis related to their mental illness or a crisis that's related to substance use. And so with 988, individuals can call 24 hours a day, 7 days a week, reach someone here in New Jersey who is trained to respond to whatever the concerns that are facing them at that moment in time. In addition to our call centers, though, the 988 system is also comprised of someone to come to you. And those are mobile crisis outreach response teams. And then the third leg of the 988 system of care is somewhere to go, which are crisis receiving and stabilization centers.
Yeah, thank you for breaking it down into those three components. I think it's easy to understand that way. What could a response look like if someone needs to come out, let's say?
Yeah, so when someone calls 988 and they want additional support other than the telephonic support, they agree to have someone come out to their home. That is a team of two individuals. One member of the team are individuals who have experienced mental health or substance use crises in their lives, and they are trained to be a part of this team to provide response. And then secondarily, there is a master's or a bachelor's level person who is also trained in acute care response that will come to individuals in their homes. Sometimes they're meeting in coffee shops, in the park, wherever wherever it's comfortable for that individual. And then there's a third member of that team, which is a licensed clinician. That person does not respond physically to the individual, but rather they're available on call 24 hours a day. And so if the team has some questions, wants to consult with a clinician, they can do so live
Yeah.
while they're meeting with the person.
So, just for a little history here, in July 2020, the FCC officially adopted 988 as the three-digit number nationally. And then in 2022, New Jersey launched 988 as part of the National Suicide Prevention Lifeline. That since then, it's been expanding nationally and here in New Jersey. But I want to talk about the budget, because we saw in Governor Sherrill's most recent budget that funding for 988 stayed flat. What does that mean right now for the expansion of the program?
So what it means is that we continue to operate the call centers. We continue to support and operate the mobile crisis outreach response teams. We received, just in June alone, we answered over 10,900 calls to our call centers, to our 988 call centers. Over the course of the last year, we have in the mobile outreach teams, we have responded to over 1,300 individuals in just a year alone. And so the funding that we currently have in our state's budget supports those initiatives. But in addition to that, though, Joanna, one of the things that we don't talk about in terms of crisis response and resources here in New Jersey is that we have many other resources that aren't formally a part of the 988 system, but yet supports individuals when they're in crisis. So we have early intervention support services. They're available in every county in the state of New Jersey. And
How do people
with our
access those supports? I'm sorry to interrupt. How do people access those supports?
So they can walk in to the EISS program in their county. They have a team that
EISS
includes
stands for,
early intervention support services. Sorry, and they can come to those early intervention support services, and it's like an urgent care center for behavioral health. And so, if someone is experiencing a crisis related to their mental health, they can go to one of these centers. They're open um, 6 or 7 days a week, and then and during the daytime and into
yeah.
some of the evening hours. And
Let
so
me
that's
ask you
a
this.
resource.
We only have a little bit of time left, and I want to get to this. I know the state's been working on these 5 regional stabilization centers. Is the fact that the funding has stayed flat going to impact the development or opening of those centers? Are they all functioning? Can you just explain where you are in that process?
Yes, absolutely. And so we are currently we really are committed to the crisis receiving and stabilization centers and them becoming fully operational. And so we continue to actively explore additional funding opportunities to support the launching and operations of the crisis receiving and stabilization centers.
So there's $28.8 million allocated. It seems that there's more funding needed to get these off the ground. I appreciate you coming on to talk about this with us, a really important topic and really, really terrific work that you all are doing on the ground for those in need. Valerie Mielke, Deputy Commissioner for Health Services at the New Jersey Department of Human Services. Thank you. Appreciate it.
Thank you very much, Noella.